Hello everyone, my name is Diego Alvarez. I'm a general practitioner here at the emergency service at Intercare Hospital. Today I'd like to show you around our recently inaugurated emergency department, and I'd like to talk to you a bit about the type of patients we see here. So this is our observation area where we have 5 different observation beds, and this is where the patient will be admitted if it's not severely sick, in order for the doctors and the nurses to do all of their work here. And you might ask yourself what type of conditions we see here. Mostly we deal with patients that have high fevers, patients that have mild to moderate levels of dehydration, secondary to vomiting or diarrhea are the most common causes. Also patients that might be extremely fatigued from the condition they've been suffering for some days. And we also deal with conditions that are a bit more serious, such as difficulty breathing. It could be a patient that has a bad pneumonia and that's affecting the capacity for them to breathe. Patients that have previous diagnosis of asthma or other obstructive condition, they're having a cold or some lung infection that is also causing them these problems. So that's what we deal here in this area, mainly emergency situations, but that are not life-threatening, so we can keep the patient under observation without having to take very quick measures. Shortly I show you the reanimation room in which we have the facility and the equipment to deal with very sick patients. So here we are in the reanimation room. This is a room that is exclusively used for patients that are very sick or that are in a condition that they might deteriorate very quickly and we need to be on top of them. In this room we deal with things such as severe dehydration or severe infections that are causing hypotension, situations such as chest pain or myocardial infarct, severe respiratory distress that might need some ventilation support, and even patients that have gone into cardiac arrest and they need to be reanimated. The good thing about this room is that it's isolated, it's not in contact with all the rest of the beds, and here we have all the equipment that we might need to deal with a patient in such conditions. This one is our vital signs monitor. It's the most basic element we have here, and it allows us to have a constant measurement of the blood pressure, the pulse rates, the oxygen levels, the heart rate of the patient. That's something that we're definitely going to use in any patient that needs to come into this room. Second, we have our defibrillator and our emergency car. The defibrillator is used to keep track of the heart rhythm, and in case a patient goes into cardiac arrest, we use the defibrillation to bring the heart back to its normal rhythm. In the IV card, we have everything that is necessary, from medicines to airway help to bags that we will use in different emergency settings, but it's everything easily accessible from here. Here we have our portable ultrasound machine. This is very useful in an emergency setting because it allows us to evaluate different things, from the level of dehydration to a patient, to signs of liquid accumulated around the lungs, to signs of bleeding inside the abdomen. So it gives us the option of having a quick next-to-bed assessment to rule out conditions that might really put the patient's life in threat. And here we have our mechanical ventilator, portable mechanical ventilator again. This is a machine that will help the patient breathe when it's necessary, which is in conditions where the patient is very sick. Basically what this does is works as a lung support. Hopefully we won't have to use it, but we have it available here. So in case we have to intubate a patient and connect them to the mechanical ventilator, it's here right next to us. Here in the ER, we have a designated area in case of traumatic injuries. This includes from just skin scraping to open wounds to sprains or broken bones. So we have a specific area where we have the suture card and the cast card that we can deal with all of these lesions right in place without having to move to other parts of the hospital. So I hope you've managed to see our new emergency service. I also wanted to let you know that at Intercare we have specialists from different areas, and in case of need we can always access them and access their service to solve any issue that comes here to the emergency. In case of any doubt, you know where our emergency is, you can always come here. If it's an emergency, we'll see you here. If it's an OPD situation, we'll walk with you to the OPD department. Thank you very much for your time and attention.